We begin with a standard intraoral scan of the upper and the lower arches. Followed by a natural bite capture. The software generates a complete 3D model of the patient's dentition. With the help of IntelliBite, the system analyzes the digital bite and presents an optimized occlusal map, highlighting contact points and occlusal intensity. To verify the digital results, we use articulating paper inside the patient's mouth. The patient bites. We once again did the intraoral scan with articulating paper marks on. And clinical photos are taken to document the actual occlusal marks. So that we can have a three-dimensional comparison. We then compare the articulating paper markings with the IntelliBite results. The digital contacts closely align with the physical contacts, demonstrating consistency between the two methods. This workflow provides a clear and efficient way to evaluate occlusion, combining digital analysis with traditional clinical validation.